Namaskar दोस्तों. Good evening and welcome to Fertility Dost. Let's talk about donor cycle. Yes, whenever we discuss about donor cycle, we do have these questions, these doubts in our mind that donor means egg donor only. No, it means sperm donor also, and in some cases, it means donor embryo also. So let's discuss about donor cycle, which include egg donor, sperm donor, and obviously embryo donor. So, when we are just deciding upon the topics, we asked our community to just pinpoint one important topic which they really want us to touch upon. And they just mention about this donor cycle. So, viewers, we know we have many doubts, many queries in our mind related to this topic. And when we just discuss about donor, when the word donor comes in our conversation, it's like, oh, should I discuss it in the public? Should I talk about this in public platform? So all these doubts do occur in our mind, but I suggest please do ask your queries on this platform. This is a perfectly safe platform for you, and believe me, we will discuss about each and important pointer about donor, why you need it. ज़रूरी है कि आपको डोनर ही चाहिए. If ever you need the donor embryo, then what to do, how to proceed further, who else can help you in this donor. So let's start with the session, and we have a senior doctor from Chennai today. So I'll just call up the doctor on the main screen, and ART Fertility Clinic is the knowledge partner for this live session. Thank you so much, Art Fertility Clinic, for arranging this special session for our viewers. Namaskar, Dr. Hema. Welcome to Fertility Dose. So, viewers, we have a senior doctor with us from ART Fertility Clinic, Chennai. She is a consultant and she worked on very important topics. She is a laparoscopic surgeon. She has done many cases related to hysteroscopy, and the most important part is her line of treatment is science based. We know each and every doctor treat the patient on scientific reasons only, but her diagnosis is really perfect so that she can treat the individual, the patient, on perfection only. So, doctor, with you we are going to discuss about the donor cycle. We have many confusions when we visit fertility clinic, and just doctor mentioned that you really need donor cycle. So what to know about this, like, am I the perfect candidate for donor? And mostly the females have these doubts or these things in their mind. What to do? Doctor asked me for donor. Is it really so? Do I really need the donor? So doctor, what you suggest for such ladies, and who are the exact candidate for this donor egg cycle?
Exactly. Thank you for the question. And whenever an IVF couple walks into the clinic with infertility, so if they decide to go for IVF treatment, like first and foremost, both from the couple side as well as from the doctor's side, we want to give them the biological child as much as possible. We want to give them the self-cycle IVF treatment only. So, but at some cases, for some couples, there are indications to use donor cycle IVF. As you mentioned before, donor cycles can be using a donor egg, or using a donor sperm, or using a donor embryo that is created using both donor egg and donor sperm. So it can be any of these cycles. So we cannot use this umbrella term donor IVF. It could be donor egg or sperm or an embryo donation cycle. So as you mentioned, it is not given as an option for all the couples. So it is only for a selected couples. So usually the candidates to consider donor cycle, or for example a donor egg IVF, is so some of the important conditions that we see. So the most common condition that we see is women having low ovarian reserve. So when they have this low ovarian reserve, so even after trying for self-cycle IVF stimulation, if they are not producing any eggs, then they get to resort. They can consider this option of taking a donor egg donor IVF. and that is the most common indication or a condition that we see, having a very low egg reserve. And then the next common thing that we see is women with advanced age. Yes, when usually the Indian law allows women to take a IVF treatment until they are 50 years of age. So, but the natural age of menopause for most of the Indian women is around 47, 48. So, by the time some of the women, if they come to us for IVF, they would have attained a natural menopause themselves. So, as a part of the natural age-related condition, in that case, egg IVF is the choice, one of the choice for them. And then those are the few conditions that we see. And then other we see is when they have this condition known as the premature ovarian insufficiency. So because some women, they have their egg reserve that go down fast, so that because the follicular going for atresia quickly, or the eggs number is reducing quickly before they could reach menopause. In that case, when they have reached premature ovarian insufficiency, or they having irregular cycles or short menstrual cycles and having a very low AMH and a very low egg reserve. In that case, if they are diagnosed with premature ovarian insufficiency, they could also be a candidate for donor egg IVF. So these are some of the common conditions in women. Those can opt for egg donor IVF.
So, doctor, usually when doctors suggest her patient about this donor cycle, the first thought is, why me? And next thought is it really safe? So, what about the safety process or safety measures associated with this donor cycle, donor egg cycle?
Yes. Why me is the most important question that comes in a couple's mind. The acceptability is improving now, because after they get all the information, and after they go through the psychological counseling and address all the emotional and psychological aspects of accepting a donor child that is not genetically related to the mother or to the father. So there goes a lot of acceptance to them. So initially we give a lot of counseling, so to increase this acceptance rate, to consider this as an option for them. And then, as you asked regarding the safety, so donor cycle safety. So for this, we sit and talk with the couple, give them all the relevant information as to how we screen and select the donor. So, for example, in an egg donor, we only recruit the donor, and we select and we recruit the donor from a very registered ART bank. So the ART bank are going through stringent standards for their screening of egg donors. Only to give an overview, only very young, healthy donors are selected. And then, so usually they are screened of all infectious diseases and most of the genetic diseases, and even their profile is matched to that of the recipient couple. So that so most of the, even they undergo with regard to safety, only they think about this transmission of viral and genetic diseases, and as well as some legal issues. So most of the standards, or most of the legality and the screening, everything is done, and only then in the final step, the egg donor for that recipient couple is actually selected, and then we retrieve the eggs for them. So safety is very much assured by the time we are starting stimulation for the egg donor for that recipient couple.
Right. So I think next time, if you are thinking about the safety and what happens if there's some issues, some genetic concern, whatever there, so please feel relaxed, because your center, your fertility doctor will obviously do the needful. So, doctor, I think donor cycle acceptance is much more than sperm donor cycle. Egg donor is much, acceptance is much more. So usually when we talk about that female ovaries are going to start this aging process after 35, but males we never talk about age, aging, sperm quality. We just say ki, yes, nature has some special treatment for the males, and sperm quality is like forever. So, what are the conditions? What are the medical concerns when you suggest males for male sperm donor cycles?
Yeah. Obviously, for some of the couples, they have this choice of resorting to IVF cycle using donor sperms. That is one of this given as one of the fertility treatment options for them. So these are couples in which the male partner has some of the conditions where he cannot naturally produce the sperm. So, or even surgically, sperms cannot be retrievable. In that case, we give them the option of using a donor sperm IVF. So as you say, so we always do the partners couple screening as together, not only the women to be screened first. Even as a basic fertility profile testing, we always include the semen analysis as the first line of testing, along with the scan or aggressive testing for the women. So semen analysis testing is one of the basic testing. Even during that basic testing, if we find that some of the conditions like azoospermia, to simplify it, it is called when there is no sperms present in the ejaculate or in the fluid, or absence of sperms, azoospermia as a condition. And then even if for that men, if they are not willing to get surgically retrieve their sperms, or even if we cannot surgically retrieve their sperms from the testis, for them use of donor sperm IVF is given as a fertility treatment option. As well as I mentioned, there are many other conditions for men for which donor sperm IVF is given as a choice. And some of the conditions are when the men suffer from severe oligoasthenoteratospermia, known as severe OATS. To simplify it, it is called when the count in the ejaculate or in the fluid is very much low, and then even the sperm quality along with it is low, and it is giving a recurrent, not producing a good quality embryo for the couple for repeated cycles. Then they opt for this donor IVF. Also when there are some genetic conditions are passed on from the male to the child, then they also choose for donor sperm IVF if they are not willing to test the embryo. Even the embryo can be tested for the genetic condition, but some couple are not ready to test the genetically test the embryo. They opt for this donor sperm IVF. Also, donor sperms can be used for both for inseminating IUI as well as IVF. So it really depends on the profile of the patients as well as the conditions in the female partner. So we assess them to decide whether we are using this donor sperm to inseminate or to proceed with IVF ICSI.
So, doctor, usually our new law says that we can have 7 matured eggs for donor. So, is there any limit related to male donor also?
For male donor also there is stringent cutoff, but for example, the ART law has also the ICMR guidelines, as well as they release this particular standards or prescribe the rules and regulations that the AR fertility specialist or the ART bank and the ART clinic has to follow before we select the sperm sample for IVF. So for sperm donors especially, we have cut off on the age, so who can be selected for us as a sperm donor, as well as we have cut off for to screening, specifically screen them for infectious disease, give them a thorough medical history and examination, and to check for the presence of any history of any genetic diseases, so that we can run that particular genetic disease. And then sperm donor also, the ART bank, they quarantine the sample for 6 months or so to prevent. It is a must for ART bank to keep the semen sample under storage for 6 months, so that even any viral diseases, if it is in the window period of the disease the donor is in, even then we can again retest the donor, and then only they release the sample. We have very stringent rules and regulations to follow before we receive the sample. And also the ART bank can release that sperm sample only for once for that couple. We cannot get the same donor twice for the same couple. So there are a lot of rules and regulations that we follow. Recently, as you mentioned, the ART Act has changed. The rules are there to protect the donors as well as to ensure safety for both sides, for either party, both for the donor as well as the recipients.
Right. Doctor, usually when we discuss about donor cycles, so it's like the success rate is much better for donor as compared to self. But again, at times that donor cycles do fail. So what could be the reason? Because it is really uh, disturbing for a couple when they are opting for donor cycle just to have that good success, or we can say that the dream to be fulfilled, and again donor fail. So what could be the reason, and suggestion from your side to our viewers that if donor cycle failed, what they should ask or they should discuss about this whole failure with their doctors?
Yes. So, very good question. Actually, this is seen as one of the very big advantage of using donor egg IVF is because the age of the egg is what matters. If the age of the egg is younger, it gives a better success rate to the recipient, even if the recipient age is advanced. So that is seen as one of the biggest advantage of using a donor egg IVF is because it gives a better success rate compared to 50-60% than compared to that of using on self eggs. But still, donor egg IVF cycle fails. For reasons. So whenever the donor egg cycle fails, we have to actually look upon for all the causes that would have gone wrong, or what could be done differently in the next cycle is what we are looking for. So when we are doing this donor egg IVF, we are doing two separate cycles. One is for the donor and the other is for the recipient. So whatever is done for the intended mother. So intended mother, what we are doing is prepare her uterus before we transfer the embryo. So
Right.
again, the uterine factor is what we have to look into. That her endometrium is developing properly, or her profile of medications that we are using to develop this endometrium is correct or not. Whether her endometrium health is what is need to be optimized if the donor egg cycle fails. Again, there is also embryo side. So better we need a good quality embryo to be created. Even if you're using a donor egg, we're also using the intended father's sperm. So sperm health also need to be assessed. Though sperm's contribution to the quality of the embryo is lesser compared to that of the egg. It
Right.
usually compromises if the egg quality is better. Even then, we need to assess if there is any quality is affected in the intended father's sperm also. As also, we need to look into the uterine factors if it is any present, or if need to be corrected. Like many of the correctable factors are there for the recipient also, like if needed resection of fibroids, or needed medical management for adenomyosis, or if she's suffering from this thin endometrium condition, or like that. Majority of the factors we need to stop and assess at that point, and then only proceed with the next embryo transfer for that couple. So majority of the times, if we correct some of these factors, correctable factors, and go proceed with the next transfer, it can result in success in the next cycle. So usually also the couple can ask the age of the egg donor that is being used for them. So the younger the age of the donor, it's better for them to be successful.
Right. So I think next time when you encounter with this failure with donor egg, or we can say that donor sperm, then please look into the uterine factor, which is really important because seed is being prepared outside. It's only soil that you have to take care of. Dr. Emma, what about donor embryo? Because many couples nowadays opting for this donor embryo, and there are many डाउट्स इन देयर माइंड्स कि कहाँ से डोनर आएगा, असेसमेंट कैसा होगा, स्क्रीनिंग कैसा होगा, एंड अल्टीमेटली because both egg and sperm, they are both the outside factor, and again when they are forming the embryo, is it really possible to have a healthy child? So what are the screening factors for that, and is it really possible to go for frozen donor embryo, or it's always the fresh donor egg and donor sperm?
Yes. As we mentioned, donor embryo, usage of donor embryo in an IVF cycle is also given as an option for couple who cannot use their own self eggs or self sperms. So here, the embryo is not going to be genetically related to the couple. So hence the acceptance may be little low, but they are going to biologically carry the child, and they're going to so the acceptance is better if they undergo this counseling initially. So, and also with regard to the screening part, because as you mentioned that we are using both an egg from a donor as well as sperm from a donor. So as it is clear that we are selecting only a healthy young female for the retrieval of the eggs, and we use this eggs for creation of these donor embryos. As well as sperm donors, they are also very much screened, and only healthy sperms, when they meet the quality standards as well as this reference values to be selected, only then the sperm samples are used for creating of the donor embryos. And so once these donor embryos are created, it is usually it can be used both in a fresh cycle as well as in a frozen cycle to the recipient. But most of the time, we prefer using it only in a because some of the time we can able to be synchronize the cycle, because when we are creating the fresh embryos, the recipient has to be ready for the transfer at that time, because we
Right.
transfer only at a specific point in her cycle. So if we are able to synchronize the cycle better, we can transfer fresh. But majority of the time, frozen embryo transfer cycles gives a better success rate than the fresh embryo transfer cycles. So because the method of vitrification, or the method of freezing the embryos, or the method of thawing the embryos has become more advanced. If done with the better hands and in a better lab, it always gives a better quality embryos back. So the quality will not be compromised in any way because of the freezing or thawing. So most of the time, we better go for the frozen embryo transfer cycles when the recipient is more ready. Most of the time,
According to that. Right.
yeah.
So, doctor, we have this query related to day 3 or day 5 transfer. So, whenever you opt for donor, so doctor or fertility clinic mentioned that you can easily go with day 3 transfer, because as we are taking healthy and younger donor, but people are really nowadays interested in going for this day 5 transfer only. So, what you suggest? What is your take on this?
Yes. So day 3 or a day 5 transfer. So day 3 embryo is a cleavage stage embryo is what we call medically. Cleavage stage embryo, or the blastocyst embryo, or the day 5 embryo. So any embryo which is getting cultured to blastocyst, or which is getting cultured to day 5, it is proving its competency. So it is one of the method of embryo selection. So when we are, so it is, even we can understand physiologically, it's like when we are transferring an advanced or a blasted embryo which has proven its competency, because it is morphologically or genetically normal embryo, can go for blastocyst. Whichever embryo which is not abnormal, which is not normal, cannot get cultured to blastocyst usually. So when we are allowing for a blastocyst culture, the embryo is proving its competency. It is proving as a method of embryo selection for us. So if we transfer a blast, it results in better implantation and a better success rate than a cleavage stage or a day 3 stage embryo. So the worldwide, all of the IVF clinics are moving only towards a blastocyst or a day 5 embryo transfer nowadays. When many of the research studies have proven that we need to transfer mostly we have to transfer only a single euploid, or that means they mean euploid, they mean genetically normal single blast transfer is a very preferable transfer whenever possible. Sometimes age of the recipient may preclude us from
Right.
transferring one. We may have to transfer two. Sometimes grade of the embryo also can preclude us from transferring one of the embryos. Sometimes couple wants two embryos to be transferred. But worldwide, for just for couple information, I'm telling that it is single euploid blastocyst transfer is the best form of embryo transfer that we can do. And especially with donor transfer also, blastocyst transfer is the best form of embryo transfer that we can choose for.
Right. And doctor, what about genetic screening? Because many times when we are doing donor cycle, we just have this thing in your mind that what about the genetic screening? So people usually ask, or couples usually ask their doctors to do PGS, PGT, or genetic screening for embryos. But when we are opting for donor cycle, is it really necessary? Because it adds on the cost factor also. So what you suggest?
Um, so now in Indian legal scenario, PGT or the embryo testing can be done only for indicated couples. So without an indication, we cannot proceed with genetic testing of the embryos. So we have to rationalize our testing nowadays. So some of the indications for genetic testing is only when the couple, especially the internal mother is of advanced maternal age, or if they're having recurrent implantation failure, or if they're having recurrent pregnancy loss, like several miscarriages, or if they are having known genetic diseases, or if the sperm quality is severely affected, or the egg quality is severely affected. So, or if one of the couple is having any severe genetic disease. So when we are selecting any donor cycle, we are ruling out many of these factors that can affect the genetic the number of the embryo. Like the age is very much restricted, because the age cutoff is there for selecting a donor, as well as we are getting a thorough medical history, and we also sometimes can do selected genetic testing if we need for the donors. If the recipient can opt for, we can go for genetic testing also. If for some carrier testing, it is available for oocyte donors, which can be done at an additional cost for the donors if the couple wants. So the donors can be screened at many point by medical history. If they give a family history of disease, they are not going to be selected. So there is a screening stop at every point. Then even then, the egg quality and sperm quality, majority of the time it is not affected. And also embryo, if it go to blast stage and also it is not affected, then majority of the time we morphologically look the shape of the embryo on transfer. Genetic testing is not much indicated when we are using a donor cycle, as long as the embryo quality looks good and it's not repeatedly failing. If it repeatedly fails also, then as an X cycle only they can give the choice of genetic testing. But still, without indication at the first cycle, we cannot proceed with genetic testing in donor embryo cycles.
Right. Doctor, we usually had this notion, or we discussed in the full session about the advantage of donor cycle. Are there any disadvantages also of donor cycle?
So disadvantages is that it is not 100% successful cycle that we can run even with donor cycles. But the success rate is considerably higher. It is one of the most effective option available for couples who are not getting successful with their self-cycle IVF, and so that is seen as a very big advantage. But the disadvantage is that there is small percentage of failure is there with donor cycle IVF also, and majority disadvantage that I would say is this couple having these concerns about this donor. So couple having concerns if they are giving a healthy donor, what if they have some diseases, what they cannot accept the child. There are so many concerns they have, that is what has to be addressed at the initial visit itself. In they are taking this option itself, all their concerns should be addressed, and they have to undergo the psychological counseling to understand that how the child, they are going to be biologically connected with the child, and they are going to rear the child, and how they are going to be connected with the child, they can be discussed with the psychological counselor. So if all the concerns are addressed, and also they have to know how we actually select the and match the donor profile with that of the recipient. So if they actually get all the information, even these concerns which is seen as actually disadvantages will be addressed about.
Right. Right. We can say that yes, we have few issues or few concerns when we are talking about donor, or when we are opting about donor cycle. But as Dr. Hema mentioned, counseling is really important part. And viewers, if you are thinking about donor cycle, then please आप ये वाला सेशन हमारा शुरू से जरूर देखिए. We have addressed few very important pointers, and if again you have some issues, then please do connect with us. We have psychological counselors with us who can help you out in this selection part. And if you are in Chennai or around Chennai, nearby areas, please do visit Dr. Hema at ART Fertility Center, Chennai. Dr. Hema, any parting note for our viewers, because we know it's really difficult for us, or it's really difficult for many couples to
Yeah.
accept this. So how you what you suggest and how you encourage when people are like in this downfall कि नहीं नहीं मुझे तो डोनर नहीं करवाना है, then what?
Yeah. So many a times we see some inhibition in the couples on their first visit. So, but I am seeing before my eyes that after a few visits with us, and after they actually see and understand this donor screening and recruitment procedures, and they undergo the psychological counseling, they very much prepare themselves to actually go through this donor IVF cycles. And my request to all the couples who are actually considering this donor IVF cycle is to actually talk to a fertility specialist and get as much as information available regarding their donors, and then it is really possible to make a right choice for them. And also, as mentioned, they really should to take this psychological counseling session to understand the treatment fully, and actually this will actually make the cycle work for them better.
And doctor, one last question. Donors are donor cycle is a closed system in our society, or it's open? Anonymous donor is preferred, or you can have donor relative, or the donor lady or the man could be your relative also. Is it really possible?
So as mentioned, it is a closed. It isn't. We allow only legally anonymous egg donors and anonymous sperm donors. The couple, the anonymity of the donor is always maintained But we give profile information except the personal information, like their height, weight, their age, and the skin color, hair color, their education qualifications, and like family background. Some of the information that are not identifiable information will always be provided to them. But a known a person cannot be a sperm donor. Likewise, in egg donation cycle also.
Egg donation also, right. So we discussed about each and every aspect related to donor cycle, whether it is egg donor, sperm donor, and embryo donor. If your doctor suggested you that yes, donor cycle is an option for you, then please don't think twice. Move ahead. The success rate is good, and plus you are not delaying your parenthood if you are going for donor cycles. And viewers, please do visit ART fertility clinics. They have many centers all over India and Chennai. People, you can visit and take advice of Dr. Hema. Thank you, Dr. Hema. Thank you so much for joining today and giving this, I can say that, wide spectrum around this donor cycle. Thank you, doctor.
Thank you so much. Thank you for having me today. Thank you.
Thank you.